Good morning, everyone. I'll go ahead and call our meeting to order. This is the Health Subcommittee of Appropriations. Thank you all for being here this morning. Before we get into the budget, I want to say a couple of things. Extend some thanks to our Chairman England, and then also to our House Budget Office and Martha and Christine and her staff over there, and especially to our analyst, Tara, who's here with us this morning. They've worked with us and helped us so much as we worked on trying to put this budget together. And also to the under Community Health, Commissioner Berry and his team over there as we've worked on this budget. And then to you all, on the members of the committee, that when we've had our hearings and we've heard from people both in person and virtually as they can share their interests and concerns with this budget that we're working on today. So I want to thank all those people and thank you all for being here this morning. Now I'm going to run through the budget changes for us, so we'll go ahead and get started. 17.1.5, this is an add of $556,000. This provides for 2 senior leadership positions over at the Department of Community Health. During this pandemic, it's pointed out the need for some help there in the administration, and this is to do that and carries through what we did in the amended budget as well. 17.4.1, this is the elimination of the 2 startup federally qualified centers that we put in last time. That was one-time startup money, so that comes out. 17.4.2 is an add of $500,000. This is to provide funds for 2 federally qualified health center startup grants in Jeff Davis County and Marion County. Then 17.5.2, this provides funds to support strategic measures for stabilizing staffing in the nursing home program. This is $7.4 million. This is for the hiring and retention and the continue to respond to the increased survey backlog so that we can stay in compliance with the federal regulations. 17.7.4, this is to adjust funds to reflect the savings from the temporary FMAP, the Federal Medical Assistance Percentage Program. Now, you're going to see this here in age, blind, and disabled, also in the low-income area, and also in the Peach Care section of this budget. Here in the ABD, it's $7.1 million. 17.7.8, this provides funds for a 2% rate increase for our skilled nursing home centers. That's $11.9 million. 17.7.9, this provides for funds for skilled nursing centers to update the general and professional liability, property insurance, and property tax pass-through rate components to current cost levels. That's $3.4 million. 17.7.10, this is to provide for a 10% rate increase for home and community-based services. That's $25.3 million. This is an area to increase for the home and community-based service providers who have not had an increase in quite some time. That's an important program there. 17.8.4, under low income, this again is the adjusted funds for the FMAP that I mentioned earlier, $47.9 million. 17.8.10, this is to provide funds to increase 18 select primary care and OBGYN codes to the 2020 Medicare levels. This is $7 million. This is to help provide an increase for our primary care providers all across the state. Under Peach Care, 17.9.3, there again, this is the adjustment for the funds for the FMAP that we mentioned earlier. That's the $4 million. 17.10.1, this provides funds for a pilot program for a drug deactivation system that provides a safe disposal of unused prescription and over-the-counter medications. That's $500,000. 17.12.1, this is to coordinate with medical education programs to develop a graduate medical education to address the shortage of medical examiners. The governor had that in there, and we're agreeing with that language and just saying yes to it, and we'll have another entry a little later on that will pertain to that as well. 17.12.4, This provides funds for the initial planning for the establishment of a graduate medical education program at Southeast Georgia Healthcare System. This is down in the Brunswick-Glenn County area. That's $180,000 to do a feasibility study to see about the primary care and residency program in that area. Under the Healthcare Workforce Board, 1713.1, this provides for the second year of a 7-year plan for the Mercer School of Medicine Medical School campus in Columbus. That's $5.3 million. When that is fully built out, there will be 240 medical students there. 17.13.2 provides funds for a medical examiner and forensic pathologist at the Mercer School of Medicine. That's $250,000. This is for a position and on the faculty as well to work with the medical examiners in Macon, Pooler, and the Columbus area. Okay, and that's it for community health. Now, if you will, flip over to the Department of Public Health, and we also want to thank Dr. Toomey and her team for helping with us. They've been through some difficult circumstances over there over this past year, and this pandemic has pointed out the needs and the things that we need to do to help them, and this budget addresses some of those with your help. So thank them for what they've done for all of us. It's been a tough year for the Department of Health over there. Under 38.1.1, this provides funds to the Georgia Core. You remember that's the Georgia Center for Oncology Research and Education. That's a $100,000 add. 38.1.2 provides funds for the Sickle Cell Foundation of Georgia. It's a $240,000 add. This restores the $115,000 that was cut in FY21, as well as adds another $125,000 back to $240,000. I know this is an issue that a lot of you have talked with me and others about, and I'm glad we were able to add that back in there. 38.1.3, this provides funds for feminine hygiene products of $200,000 that will go through the health department. 38.3.2, there again, this is helping the Department of Health with their administration positions over there. You remember that we had put money in the amended budget to begin this program. This provides funds for a chief medical officer, a deputy commissioner of public health, and a chief data officer to support the agency with the pandemic response, as well as provide for ongoing public health leadership. That's $857,000. Under epidemiology, 38.5.1, this provides funds for the ongoing maintenance and operation of the new vaccine management system. That's $1.5 million. You remember in the amended 21 budget, we put in over $16 million to stand up that system, and this is the operational and management of that system that will be in there to help them make the decisions as we continue to deal with this pandemic. And that completes the changes in the budget that we have there, and I'll open it up now for any questions or comments from members of the committee. Let's see. Is that Representative Hughley? Okay.
Thank you, Mr. Chairman. I just wanted to make mention of the fact that the dentist had a request that came in relatively late in the process. Since my dentist sent it to me, I wanted to publicly make that mention and have you respond to that.
Well, thank you. We were a little late in getting some of that information, and as you know, the budget is a process. We're not finished with that yet, and certainly we've been able to help them over the last few years, but we certainly want to look at that and see what we can do.
Let me also add my thanks to you, Mr. Chairman, and to our budget analysts and everyone for the work that you've done on this budget.
Thank you. Any other comments or questions? If not, we'll entertain a motion. Have a move and a second that do pass. Any other discussion on the motion? All those in favor, please say aye. Aye. How about virtually? Anybody? Okay. Any opposed, no? Motion passes. Thank you very much.